specific food that they need to avoid when they know that they have polycystic ovaries?
So a lot of times inflammation, like we said, is something that's seen in a lot of women with PCOS. So there are certain triggers to this inflammation. One main trigger is processed foods or unhealthy fats or saturated fats, as we call them. This is something that messes up your gut balance. It causes a lot of acne, and acne is one of the main key primary feature of PCOS. So deep fried foods is something I ask them to completely avoid, and sugar. So added sugar is something I tell them to avoid completely. Natural sugars are fine, but try avoiding that 1 teaspoon of sugar that you're adding to your tea or 3 times a day. And coffee, again, I think a lot of PCOS women know this, but we're just lazy to adapt it. But having more than 200 mg of caffeine, which is about 2 cups of coffee in a day, is super harmful for PCOS. It could cause more inflammation. It could cause changes even in your menstrual cycle. So predominantly it's caffeine. Dairy, again, up to an extent, it does cause inflammation. So only in cases where it's indicated that dairy could cause an inflammation in someone with PCOS, we ask them to avoid it.
So avoid processed food, avoid adding extra sugar to your drinks or whatever you are taking. Cut down on the caffeine that you are taking every day, not more than 2 cups of coffee per day. And of course, cut down the amount of dairy that you are including in your food.
Correct.
Okay. So we have a lot of fancy diets these days. The keto diet, Mediterranean diet, low-fat diet. Anything specific that you would advise these women?
Honestly, I'll tell you first the list that I don't advise women with PCOS to do. One is definitely keto. So keto, research says that short-term keto, like 4 weeks under professional guidance, is still okay. But that is if you've exhausted all possible ways of trying to lose weight. And if your BMI is more than 40 only. If you follow keto for a prolonged period of time, which is post 4 weeks, then once you stop it, you'll regain all the fat back, and predominantly in the abdominal area. So keto is not something I advise at all, or a low carb diet for that matter of fact. Carbohydrates are super important for energy levels, for mood, to keep your cravings at bay. Mental health has a very important role in PCOS as well. So cutting carbs, cutting that one source of happiness from your life can worsen all your mental health, can worsen your mental health as well. So having whole grains is something that I would push people to. So talking about a specific diet, there isn't any specific diet, but if we are looking at dietary guidelines, there is a low GI carbohydrate diet, a diet with a lot of lean proteins, an anti-inflammatory diet, or a diet which avoids all the inflammatory triggers. And in some people, a dairy-free and gluten-free diet could also help, since these are related to causing inflammation. But until it's indicated, we don't push people to completely avoid any food group.
Okay, so no fancy diets.
No fancy diets.
Okay. So what is seed cycling?
Very good question. So, so seed cycling is a 100% naturopathic approach. So it's not evidence-based yet. There is a lot of limited evidence to seed cycling working or not. But given the fact that the theory behind it is pretty straightforward, we recommend it. Now, what exactly is seed cycling? So as we know, our menstrual cycle is divided into 2 major phases. The follicular phase, which is day 1 to day 14, sorry.
Or 15, that's okay.
Day 14. And day 14, 15 to day 28 or day 30 is your luteal phase. So in the follicular phase, we're looking at improving or increasing your estrogen levels. Now, pumpkin seeds and flax seeds is what supports that improving of that estrogen level. So we give a lot of pumpkin seeds and flax seeds. Not a kg of it, but just a tablespoon is more than enough. And then day 14, 15 to day 28, 30 is the luteal phase, where we're looking at more progesterone to be released. So for that, we look at a lot of sesame seeds and sunflower seeds. So 1 to 2 tablespoons of these seeds at a specific time to be taken every day. It does not work if you take once in the morning, once in the evening, once in the afternoon. So we try doing it at a specific time on a daily basis for those 30 days. The benefits of it in the long run, so post following it for 2 to 3 months, it can help improve PMS symptoms, menopausal symptoms as well, and irregular periods too. So that is something I just try asking people to do, because even if there's no evidence behind seed cycling working, the nutrients that comes with it are the plus point. Exactly.
Okay. So the pumpkin seeds and flax seeds in the first half of the cycle.
Correct.
And sunflower seeds and sesame seeds in the second half of the
100%.
cycle.
Yeah.
All right.